I always dreamed of being a physician in a small community on the water somewhere in eastern North Carolina. So this area with the ocean and the sound and the water immediately accessible, it's a natural place for me to be.
I applied to the Kenan program and was interested in rural health. I'm from Aberdeen, North Carolina, Hope County, grew up there. I'm part of the Lumbee tribe on my mom's side, so been surrounded by my tribe my whole life, participated in powwows, everything. And what I saw when I was growing up was a lot of my family members and a lot of my tribe were dying from these chronic illnesses that they shouldn't have been dying from, so like diabetes, hypertension. What I was seeing was that a lot of people were afraid to go to the doctor. One, because they didn't have the access, but two, they just didn't feel as comfortable going to a doctor who didn't look like them, who didn't know like where they came from. And so I thought it'd be really cool if I could go to medical school, become a doctor, and then go back to that same place where like I know the people around. I know I go to the same church with these people and went to school with their kids.
Generally, there's been a shortage of primary care physicians in rural areas. In North Carolina particularly, the healthcare population has suffered as a result.
I talked to a couple patients and they were driving like 30, 40 minutes to get to the hospital.
If you look at the impact of a primary care physician in a rural area, it's not hard to see the improvement in the health care of the people who live in that community once a primary care physician moves in and starts practicing good quality medical care.
Every patient that I've seen with Dr. Blair and Dr. Davis at Pender Memorial is just so appreciative of what they're doing and just like in awe of Dr. Blair coming in and seeing them, and I was like, I want that.
The relationships that you develop over a course of medical practice, you really could not find in any other setting.
It's been really cool to take what we've learned in the classroom and actually see it happen in patients.
Being in primary care in a rural area has given me the ability to really practice medicine at the level I was trained, and has enabled me to learn and expand my horizons medically and professionally into areas of interest that I would not otherwise be able to pursue.
It's been really nice, and it's nice to kind of relax, see the ocean. I've also started just like visiting different farmers markets along the road, so if you just like stop at a stand while you're driving along one of the small back roads or highways, I like doing that and talking to people there.
You really have to integrate yourself within that small town to establish those long-term personal relationships that are so valuable. I was always taught that medical education doesn't stop when you graduate from medical school. It's a lifelong process, and that's certainly even more so true in rural primary care.